Hi, Alex Shade here again. This is a video footage, or this is a video footage. This is a video following up from week 9 discussion thread number 2. Question number 2. How is the integration of EHR by 2014 going to help improve and hinder both the patients, providers, and the medical community at the local, national, and international levels? I want to take this time to provide a brief overview and an introduction, just to help remind us and to set the scene for what EHR is, what EMR is, and the difference between the two. According to the official website for the Medicare and Medicaid Electronic Health Records Incentive Program, sometimes people use the terms electronic medical record, or EMR, when talking about electronic health record technology. It is not uncommon to find that both providers and vendors use the terms interchangeably. One of the major differences between EHR and EMR is with regard to how the data stored electronically is used and shared. For example, while EMR relates to the confines of a practitioner or a single health office, the EHR relates to the sharing of documents across different providers. One quick overview is there, which is actually a very good site that can be found online. Differences between EHR and EMR points to four main summary points. Number 1, while EMR relates to the confines of a practitioner or a single health office, the EHR relates to the sharing of documents across different providers. Number 2, while EMR is only the electronic data of a single diagnosis, the EHR is a comprehensive view of the patient's overall health condition. Number 3, EHR can be said to be a comprehensive data of the health history of the patient. And finally, number 4, EHR is more useful in the treatment of a patient as it contains up-to-date information of a patient's health condition. As EMR pertains to only the clinical data of a patient of a single clinic, it cannot be said to be complete in all aspects. It is also important to note that too much information and data may overwhelm or distract the end user, so the EHR systems must have well-designed interfaces. The Institute of Medicine of the National Academies has devised a common industry standard. This was done in 2003 for EHR functionality that will help guide the efforts of software developers. These 8 core functions have been identified and are as following: health information and data, result management, order management, decision support, electronic communication and connectivity, patient support, administrative processes and reporting, and last, reporting and population health. Furthermore, the health information and data captured by an EHR system must also evolve over time. As new knowledge becomes available, both clinical knowledge and knowledge regarding the information needs to be applicable and functionable by all end users. So let me now take some time to go through and highlight some of the positives and some of the negatives as they pertain to those roses and thorns to the question number 2. Positives. Integration of EHRs will increase the availability and accuracy of medical information regardless of patient location. Healthcare providers need to be able to quickly access patient medical records to ensure accurate treatments are provided in a timely manner. This widespread use of EHR will make it easier to access patient information when the patient moves from town to town, state to state, or country to country. This is a green initiative, so reducing the amount of paper used will be a benefit for our environment. At the local level, EHR allows one comprehensive system for a patient record. In an EHR, the categories will be preset and you can populate them as you go. It will greatly benefit patients at a local level when they can walk into any facility and they do not have to repeat every single thing that has ever happened to them. The EHR should be able to take care of that. Yes, we all long for the days where there are no more forms to complete, especially after you complete paper after paper after paper after paper form. You would think at this point they would all be digitalized. The EHR will help at the national level because it will allow for greater reporting features so that the government and other regulatory bodies will have access to important healthcare figures. For example, if they realize that 70% of the people are obese in the United States, then they could begin a national campaign to fight obesity. That was one example that was offered by a fellow student. Next, the EHR will help at the international level because we will be able to share statistics and experiences more easily since the information will all be electronic. We could potentially help developing countries on a deeper level since the information will most likely be accessible from anywhere in the world. We can share examples and help train medical professionals in other countries based upon the data we've collected in the United States. The good thing is that a healthcare provider at any integrated EHR compatible user facility can pull up records on any particular patient who walks into any facility and retrieve all their information from their last admissions. Nurses who float between these facilities will be familiar with the electronic records as the system will be the same everywhere. The last is that patients will benefit from EHR integration because it should more easily link communication between healthcare providers, thus ensuring the healthcare process works more smoothly. This form of communication would likely decrease ordering tests that have already been done. The integration of the EHR is and will be a great improvement to information sharing and connecting patients and providers across specialties. The use of the EHR improves the availability of the patient record from visit to visit. Unlike the old days when medical records would have to be pulled, i.e., the paper chart, if the provider wanted to see what happened to the patient in the past. I think the biggest benefit of the implementation of the EHR by 2014 will be the ease of information sharing across specialties, state lines, and even countries. The provider is better able to treat a patient appropriately if he or she knows exactly what medication and what the heck is going on with the patient in terms of helping them to take care of their medical problems, treatments, and any other issues that they may have. Here are some of the negatives, and there are quite a few, so let's get right into it. One of the biggest snags out there when it comes to the EHR has to do with implementation. According to several of my classmates, they feel it will take years for people to quote-unquote get on board and fully utilize the system. There will definitely be growing pains. Cost would be a huge factor that many see as hindering providers and the medical community. Technology is ever-changing, and implementation of by 2014 would mandate facilities are at code within a short period of time, although I will say that, hello people, we've had 10 years to get the system in place. So, time, I don't know if I would agree with that one, would cause some facilities to incur costs they would normally not have to incur. In this case, not having the right IT support, for example, would greatly affect the adoption and utilization of the EHR. The system may not be very efficient or safe at the beginning, but as time passes and the system is perfected, we do hope that it should be made available for all and ensured a safe, effective way to manage patients' care. Another hindrance would be that of patient skepticism. Patients would have to quote-unquote buy into the notion that EHR integration would be of benefit to them and that their privacy would be protected and in addition with the institution of EHR. Another large obstacle will be the fact that EHR organizational usage changes with each system. Smaller practices in rural areas also may be having a difficult time putting the EHR to use. This lag in adoption could have a ripple effect to larger areas where the EHR is already in use. Continuing on the rural aspect, it will be difficult in these areas as some of these providers may not even be familiar with the basic functions of a computer. It is sad to say, but patients will fall between the cracks during the initiation of EHR in regards to record transfer. Several classmates have also voiced their concerns and opinions accordingly. For the most part, the majority agrees and highly doubts that implementation of the EMR EHR will be completed by 2014. Another major issue is the fact that organizations use different EHR systems and at times they do not talk to each other. Another issue that was revealed by the YouTube videos is that there is competition between vendors for the EHR systems. I think a very simple truth is that not all people are aware of this mandate. When I spoke with friends and families, a large majority of them had no clue that the U.S. government was mandating EHR by 2014. In addition, several of them had more questions that needed further clarification and explanation from me. Unless there is some sort of uniformity between the EHR of the various healthcare systems, I am not sure how the same information can be obtained nationally or internationally. One thing that we must remember and consider is that EHRs can only be accessed as long as one has an internet connection and availability to one's individual record. Interoperability is the goal and what the 2014 mandate has hopes to attain and to provide for each individual who seeks it. Therefore, because there are the pluses, the minuses, and the things to consider, I do hope for those that have waited on this discussion, they do take that time to internalize everything and hopefully realize that let's make sure that the good outweighs the bad and everyone is compliant by 2014.